Hello friends, welcome back in the channel of Clinical Care Insight. We started a series of lecture on the reproductive system, okay? And in the first lecture, we only discussed about the basic outline of reproductive system, understand? Then we started to discussing about the menstrual cycle. And as I said that for understanding the menstrual cycle, first we have to understand the female reproductive part. Yes or no? Okay, so for that we think, okay, during the menstrual cycle there are changes, okay, and these changes are not limited only to one specific part of the you can say the female reproductive system. It's like wide, okay, it's affect, or you can say there are changes, okay, starting from the higher system, okay, to the uterus, cervix, ovary, understood, vagina. So all these parts will be changed, okay, during the menstrual cycle. Now, so in this journey we already discussed about the ovary, okay. We said that ovary is a primary gonads in female, of course it is in female, okay. And then we can say make conclusion that the ovary, if we talked about the function of the ovary, then ovary does two functions. That's the important function. First one is called the gametogenic function, means that ovary produce the gametes, and in the case of female, the process of formation of gamete is called as, it's a oogenesis. Very good. And we seen that during the oogenesis, okay, there is a formation of oogonium. There is a formation of oogonium, or simply we call it's a ovum. Second function of the ovary is production of hormones. Without hormones you cannot imagine about the menstrual cycle. Today you see that phenomenon, that how hormones play a crucial role during the menstrual cycle. That's the two function we've seen, okay, and there are other function as well, but two function we have to keep in our mind, okay, fine. Then we've seen that the ovary changing, okay, ovary content is changing, okay, during the development time, okay, during the development time. Now today we will discuss in detail about the menstrual cycle. So today our topic of discussion is, write it down, it's a menstrual cycle. Now, there are other alternate name. There are other alternate name for the menstrual cycle. Can you cite any name? Yeah? Can you cite any name for the menstrual cycle? Yeah? Very good. It's also called as, monthly cycle. Very good. It's also called as monthly cycle. Very good. Another name can you cite for the menstrual cycle? Yeah? Okay. It's a very good. It's also called as the fertile cycle, or you can say fertility cycle. Because why it's called the fertile cycle, or you can say fertility cycle more specifically? Why? See, nomenclature is associated with their properties. It's not about only us, okay, your father and mother given you one name, okay, because they are not seeing your future, they just imagine and given your name, okay, that's called the nomenclature. So for science also, for biology, okay, for physiology we can say, it's also there are names and there is a story behind the name. Why this is called as the fertile or fertility cycle? Because only, you can say, during the menstrual cycle there is one specific period in which a woman can conceive. Understood? That's why they are also called as the fertility cycle. And don't forget, it's also a kind of natural cycle, okay, it's also a kind of natural cycle. Now there's a reason behind the natural cycle also. See, Females have this menstrual cycle, okay? It's starting in a one specific time and it's end on one specific time. Understood? You can artificially induce, that's a clear, but there's a need for one time period, okay? Before the age of, you can say, like the average, recently the average, you can say, the menstrual cycle starting period is considered as 12 to 16 years, okay? 12 to 16 years in the modern countries, okay, which is developed countries. Their menstrual cycle starting period is considered as 12 to 16. Understood? But most of the girl, or we can say the 98% girl, okay, 98% girls, they started their menstrual cycle, if we take the average, then it's a 15 years. Understood? So before this 12 year or 16 year, okay, you cannot induce this cycle. You cannot, yeah. You can inject the hormone, okay, those hormones which is responsible for the, you can say, this menstrual cycle. You can, but there are abnormality associated with that. Okay, if you inject the hormones, okay, you try to mature a female as far as the menstrual cycle is concerned by inducing a hormone, okay, it's not lead to the, you can say, the good development, okay, it's not lead to the good development. That's why the cycle is a natural cycle. It happens by their own way, okay, it ends by their own way. Understood? No problem? Now, okay, so what do you call this period when the menstrual start, female start the first menstruation? Yeah, there are one term, you know it, yeah, tell me. Very good, it's a menarche. Write it down, menarche. So commencement, or you can say the starting of the menstrual cycle, okay, is called as the menarche. Now the hand by hand, you also say me the permanent stoppage of the menstrual cycle or permanent cessation of the menstrual cycle is termed as, yeah, it's a, very good, it's a menopause. Menopause. Now male are thinking ki, okay, like the females, they have one specific time period, only on that time period they can bear a child, but we can bear a child forever as far as we maintain our, we can say, health or immunity. We can able to produce a child, okay, by giving our sperm. Now in males also, some of the males, okay, there is one term which is applied for their inability to produce a child, okay, in the old days, and that is called as the andropause. Andropause. Understood? No problem? Now, once you understand about what is the menstrual cycle, first thing is it's a monthly cycle, okay, and there are alternate name used for it. First one is called fertile cycle, also called as fertility cycle. Now you know the story behind these names. Then it is also called as the natural cycle. It's also called the natural cycle. But we didn't understand what is actually a menstrual cycle. Understanding that, okay, it is called as monthly cycle, fertile cycle, fertility cycle, okay, natural cycle. But what is menstrual cycle? Yeah, can you give me exact definition of the menstrual cycle? Yeah, okay, first understand this menstrual cycle, as you know, that is happening each and every month, okay, until a female can attain this stage, menopause stage, okay. Starting from the menarche and the, you can say, the menopause, every month there is one cyclic event is happening in a female body. First of all, just write down the first cyclic event. Cyclic events is happening in female body, okay, and by this, you can say, event, female reproductive system undergo changes. Female reproductive system undergo changes under the influence of hormone. Write it down. Female reproductive system undergoes changes. Okay, how? Under the influence of hormones. Do you remember in initial part of this lecture, as I told you, that the hormones play a crucial role during the menstrual cycle. If there is a proper reproductive organ is present in the female, but if they lack these hormones, they won't menstruate at all. Okay, they are not able to menstruate, okay, in the deficiency of these hormones. And we will see in our further lectures about the disorders, okay, ovarian disorder, which is responsible for lack of menstrual cycle. Understanding? No problem. Now, there are two principal hormones you should bear in your mind. The first hormones, the female sex hormones, is your estrogen. Okay, understood? Now, the second hormone is your, yeah, can you name them it? Very good. It's a progesterone. Under this influence of estrogen and progesterone, okay, female undergoes cyclic event each and every month. Each and every month. Now, you understand this hormone's role? Now come to this menopause. There are many theories. Regarding the menopause, okay, but one of them is acceptable for a wide, you can say, the range of people, and that state that due to the deficiency of estrogen and progesterone, female have menopause. Okay, shall I repeat once again? Okay, due to the deficiency of estrogen and progesterone, female have menopause. Understanding? No problem. Now, once you understand what is the, you can say, the female reproductive system, understand what is the menstrual cycle, how hormones play a role. Okay, till now you just know it superficially. We will know in detail how they play a role. Okay, but then you should tell me the length, duration of menstrual cycle. Okay, now you tell me the duration of menstrual cycle. Yeah, it's 20 days, that's known. 28 days. That's why this is also called as the monthly cycle, monthly sexual cycle. Now, it's a 20 days. But females' reproductive system don't read textbook, no. It doesn't read textbook, okay. It's not depend upon this 20 day. Some of females have shorter menstrual cycle, okay. Some of female have, you can say, the longer menstrual cycle. Understood? So what is the range which we accept that, okay, that's a normal physiological, you can say, the menstrual cycle? Can you tell me what is the range? Yeah, okay, fine. It's a 21, okay, to, you can say, the 40 days. 21 to 40 days, okay, this is the range. If female menstruate less than 20 days, okay, that's a kind of pathology, okay. She have to be investigate what problem is occurring on her, okay. If she menstruate, okay, after the 40 days, okay, that's also a kind of pathology, okay. That's also a kind of pathology. We will see a few terms. Right now I'm just giving you the superficial idea, just know it. The first term is called amenorrhea. Okay, first one is called as the amenorrhea. Second one is called as the oligomenorrhea. I'm talking about the applied aspect of this menstrual cycle. In amenorrhea, there are types, primary and secondary. Some of females what have, like they don't have menstrual cycle, okay. Starting from when she attend this age, this menarche, and she don't have any menstrual cycle, Okay, that's the kind of pathology that shows that their reproductive system is not, you can say, the mature or not structurally developed properly. Okay, their reproductive system not developed properly. Okay, and if she attained the age of 16 years, okay, until this year she is not able to menstruate, then there must be need for the investigation. Okay, then there must be need for the investigation. 16 years is considered as a last, or you can say it's like a, it's extreme. Okay, where females have to check why she is not menstruating. Okay, and there are you can say the diseases. Okay, and the genetic diseases play a very drastic role. Okay, genetic diseases, they affect very much menstrual cycle. And another is the hormonal deficiency. It's clear that the female reproductive system is dependent upon these hormones, and if there will be deficiency, female cannot menstruate. Okay, she is not able to menstruate. So there are genetic disorder. You read in our further lecture. There's called the Klinefelter syndrome. Okay, where there is a very rudimentary, or you can say sometimes there is no any uterus at all. Okay, sometimes there is a absence of ovary in the females. Understood? So these are the genetic diseases, and there are treatment. If it's diagnosed earlier, then there are treatments. Okay, and there are assisted reproductive techniques. You already know about the IVF. Okay, which ensure the pregnancy in these kind of females. Understood? No problem. Now that's about the primary amenorrhea. Okay, and there are the secondary amenorrhea as well. Okay, in which female menstruate. Okay, and there are a gap, 6-month gap, and after 6 months they again, you can say, menstruate. That's called the secondary amenorrhea. Okay, M means absence, amenorrhea means menstrual cycle, and there are oligomenorrhea. Oligo words denotes few. Okay, if there will be you can say there are 7-week or 8-week gap between the menstrual cycle, that's called the oligomenorrhea. So we will discuss it ahead. Let's first understand the normal physiology, how the menstrual cycle is happening. We will discuss about the duration, that the duration is average 28 days, but female are allowed on normal physiology function, female are allowed to menstruate 21 to 40 days. Okay, if it's less, then also a pathology, and if it goes beyond, then it's also a pathology. Okay, and there are terms called the amenorrhea, oligomenorrhea. These are the conditions. Okay, abnormal menstrual conditions where female menstrual cycle is disturbed. Okay, now let's start with understanding how this menstrual cycle is happening every month in the females. Okay, so as I said you that the menstrual cycle is happening every month. Okay, it's happening in every month, but what internally happen in the female body? Okay, what things is, you can say, the changing in the female body, how she is able to menstruate? Okay, can you give me any idea? Do you have any idea? Yeah. Okay, tell me, like, you start studying the menstrual cycle from which part first? See, there are a role of hormones. Okay, and ovary produce the hormones. Ovary produce the hormones. Which hormones? The estrogen and progesterone. Understood? No problem. But the thing you should remind in your mind is that ovary is also you can say under the higher systems, isn't it? Yeah, is it true that ovary is under the, you can say, influence of higher system? Yeah. Okay, which higher system? Very good, it's your hypothalamus. It's your hypothalamus. Understood? Hypothalamus is a part of central nervous system. Okay, it's a part of central nervous system, and it's control the female reproductive system every month. Okay, if we talked about how the female reproductive system is regulated, then we should keep in our mind there is involvement of higher system. Okay, this reproductive system is not a, you can say, the light system. You cannot take it lightly. It's a very, you can say, superficial system. Okay, it's have involvement of the higher system, and one of the higher system is your hypothalamus. Hypothalamus inflames the pituitary gland, isn't it? Which pituitary gland? Very good, it's a anterior pituitary gland. Anterior pituitary gland. Fine, no problem. Now, anterior pituitary gland influence or give the message to the, very good, it's give the message to the ovary. Okay, and ovary will further give the message or command to the uterus. Now you may thinking how. Okay, science questions generally not end up by the full stop. They end up by the question mark, isn't it? So the question is, how hypothalamus first influence the anterior pituitary? For that you have to see where hypothalamus is located exactly. This is your cerebrum, okay, midbrain, pons, medulla, and this is your spinal cord. Now, your hypothalamus is located somewhere here, okay, and under this, there is a once I am discussing about the pituitary gland, okay, and then I asked, okay, did you recognize this structure? And one of the student, I don't know how, but he said it is a scrotum. It looks like a scrotum, but you don't misunderstood it. It's your pituitary gland, and this part is your anterior pituitary gland. This is your posterior pituitary gland. Now, this is present anterior side, it is your anterior pituitary gland. This is present posterior side, it's your posterior pituitary gland. But you know it that hypothalamus, okay, as far as the female menstrual cycle is concerned, it only stimulates the anterior pituitary gland. Now, hypothalamus have a many nuclei. Okay, if you remembered it, then in the neuroanatomy and neurophysiology lecture we discussed about that in the case of the central nervous system, the neuronal, you can say, cell body collection is called as the nuclei. Understood? So in the hypothalamus, okay, in the hypothalamic area there are many nucleuses, but one of the nucleus is present, and that is called as the caudate nucleus. Write it down. Or it's also called as arcuate nucleus. Understood? It's called as arcuate nucleus. Now, these nucleus have the neurons, okay, and these neurons secreted some of the chemicals. Okay, it secretes some of the chemicals, okay, and these chemicals influence the anterior pituitary. Now, you heard about the hypophyseal portal system. They have the very unique, you can kind of the vasculature, a blood supply present between the hypothalamus, okay, and the anterior pituitary. Okay, I should draw it. Okay, this is a unique kind of vasculature, understood, where these chemical substances, they come, okay, they come in anterior pituitary. Can you name them this substance? Yeah, can you name them? Very good, it's your GnRH, gonadotrophin releasing hormone. Okay, remember the term gonadotrophin. Gonadotrophins means such hormones which have trophic action on gonads. Okay, in the case of female, the gonads is ovary. Okay, and in the case of male, the gonads is testes. It's easy to understand, no problem. Now means these hormones have the growth action, the trophic action on these organs. Okay, in the case of male it is testes, and in the case of female it is a ovary. No problem at all. Yeah, are you following, understanding? Now come to this point. These chemicals, okay, which we term that is the gonadotrophin, that's called the GnRH, it's sent to the anterior pituitary. No problem. Now anterior pituitary, in response of this, okay, they send two, you can say they produce the two kind of hormone, okay, which is very much familiar to you. You are studied from the earlier classes as well. And this hormone, the first one is called as the FSH, follicular stimulating hormone. Okay, and the another one is called as the LH, luteinizing hormone. Okay, luteinizing hormone, understood. This FSH go and work on the ovary. Okay, understood. Ovary will secrete estrogen and progesterone, okay, which will also, you can say, stimulate the uterus, lining of the uterus, understanding. So whenever you talked about the female menstrual cycle, you must start from the higher system. Okay, it's a hypothalamus which secrete the GnRH. Okay, and in response of this GnRH, your anterior pituitary secrete FSH and LH. Okay, and by this the ovary stimulate also the uterus. Did you understood it? Now one thing you keep in mind, if the okay, this axis, okay, this axis is given one very beautiful name, and that name goes like this. It's called as the hypothalamic, okay, hypothalamic pituitary ovarian axis, HPO. Okay, hypothalamic pituitary ovarian axis, it's called as the HPO. Now you just remember for a while that if there will be any abnormality, in the secretion of this GnRH, females have problem in their menstrual cycle. Are you understanding? If there will be any tumor formation, okay, if there will be any tumor formation in these anterior pituitary, they have again the problem in their menstrual cycle. Understanding? If they have any problem in the ovary, okay, you heard about the PCOS, the primary ovarian syndrome, okay, sorry, polycystic ovarian syndrome. It's a polycystic ovarian syndrome due to the imbalance in the hormones. Okay, they can then also can problem, understanding, if there will be any problem in the uterus, okay, then there will be also a problem in the menstrual cycle. So for investigating the menstrual cycle, you should need to always investigate from the higher top till the bottom. Are you understanding? Okay, no problem at all. Yeah, we can understand anything more from this. Okay, so you just conclude in your mind for a while. I'm not going in detail right now that this hypothalamic pituitary ovarian axis, okay, it is very, you can say it's subject to prawn it at any level, okay, it's subject to prawn at any level. There will be any abnormality associated with the hypothalamus, maybe it's problem with the pituitary gland, maybe there will be problem in the ovary or the uterus, okay. And you know it that females, when she will become too emotional, okay, if there will be many, she is taking too much stress, okay, if she is not, you can say, following the normal lifestyle, okay, on that very moment their menstrual cycle get also affected, okay. And you know it, the control of the mood control is done by which system? Yeah, don't know, don't worry, many things we don't know in our life. The first thing is limbic system, okay. This limbic system which is present in our central nervous system, this is controlling our mood, okay, anger, memory, understanding. So if a female is too emotional, okay, their menstrual cycle get also affected, okay. And fat, or you can say the BMI, body weight, they also play a very crucial role, okay. If by any reason, okay, if by any reason the body weight distorted to 17%, okay, then there will be problem in female's menstrual cycle, understood. So body weight is directly correlated with the, directly correlated with the menstrual cycle, okay, directly correlated with the menstrual cycle, understood, no problem. And why we need to understand these all things? Because you have to ensure the, you can say, the patient, because the menstrual cycle is directly correlatable with their fertility, okay, directly correlated with their fertility. So there is need for understand this topic in detail. Now once you understand the involvement of the higher system, let's talk about the cyclic event in the female reproductive system, okay, the cyclic event in the female reproductive system. Okay, so what we done, first thing we remember, we already discussed that there are changes, okay. If we talked about the changes during the menstrual cycle, okay, then there is a changes in the hypothalamus, higher system, okay, we understand that. Now there is a changes in the ovary, okay, there is a changes in the uterus, there is a changes in the vagina, and there is a changes in the cervix, okay. There is a 4 level of changes, but we only have to focus on the 2 changes. That first one is our, write it down, the 2 changes. You should always forget the all concept, okay, all the changes, but remember the 2 changes. First one is your ovary, okay, and another one is, another one is your uterus. Ovary and uterus changes you should bear in your mind, understood, no problem. Now let's talk about the event, what changes happening in the ovary, okay. So I'm starting again from your, that's your hypothalamus, and it have the pituitary gland, okay, and there is one nucleus, can you name them it, arcuate nucleus, and there is the presence of one unique kind of vasculature, okay, and via this there is a coming of the secretions. No problem. Now, so this is day 1, okay, and till we taking the average 28 day cycle. Understood? Now, and in mid there is a 14th day. So we will see what changes happening in the higher system, what changes happening in the ovary, okay, what changes happening in the uterus simultaneously. Understood? No problem. Now, during the first day, okay, during the first day, what changes happening in the ovary? We already studied the structure of the ovary. Yeah, can you recall the structure of the ovary? Ovary is a oval in shape, okay, it's a flattened round shape, okay, it's a flattened round shape, lined by the germinal epithelium cell. Very good. Okay, and ovary have the two parts. Ovary have the two parts. Yeah, the dense part. The dense part is called as, yeah, it's your medulla. And the outer part is called as the cortex. Okay, outer part is called as the cortex, and this part is also known as the, yeah, it's also called as the stroma. Okay, a stroma of the ovary. Understood? Now, so what do you think that female reproductive cycle started from which time period? Yeah, the actual menstruation is happening after the menarche, but the changes which take place in the ovary, we already discussed in our previous lecture, is starting from the intrauterine life, isn't it? So females plan ahead of a man as far as this bearing a child is concerned or pregnancy is concerned. They are wiser than us, wiser than male. Okay, so during the intrauterine life, female have some of the germ cell. Okay, female have some of the germ cell, and these germ cells undergo the oogenesis. Okay, the oogenesis is different from the spermatogenesis, because here only one ovum is present, but in the case of the spermatogenesis there is a 4 sperm is producing. Okay, so this is your one ovum. Okay, you can say one ovum, and it undergo the two cell division. The first one is your meiotic 1 division, okay, and another one is the meiotic 2 division. So this ovum, they change into the, undergo the division, and it forms one ovum and one polar body. Okay, one ovum and one polar body. Now this ovum, they undergo meiotic 2 division, okay, and they produce again one ovum and one polar body. Understand? And this polar body will produce the 2 polar body. So in the case of the oogenesis, from the one ovum there will be formation of one definite ovum. This is ovum, this is called primary ovum, this is called as the definite ovum. Understanding? No problem. Now these polar bodies, okay, from one polar body there will be formation of the 2 polar body, and from one ovum there will be formation of the one definite ovum and one polar body. Means in the oogenesis, okay, and at the end of the oogenesis there will be formation of one definite ovum, yeah, and 3 polar body. No problem. Understanding? Now this ovum, in the, you can say, the ovary environment, okay, they come into this cortex region, okay, and it will surrounded by the flattened cells. Okay, it will surrounded by the flattened cell. Understanding? Can you name them this cell? This is your granulosa cell. Okay, this is your granulosa cell. granulosa cell. Every month 15 to 20, okay, 15 to 20, or on an average 14, this type of, you can say, the cell start this cycle, okay, participate in the menstrual cycle. But you know, at the end only one will be selected, other will be eliminated. How? You will see. Sorry. So this one definite ovum, okay, one definite ovum, they are surrounded by the flattened cells, okay, and this flattened cell is called the granulosa cell, okay, and this whole structure is called as the primordial cell, okay. Write it down. This is called as the primordial cell. No problem. Now it have to change in other structure, okay, it have to change in other structure, but how? Yeah, tell me how it changed. One thing you keep in your mind, the secretion of this hypothalamus GnRH and then the anterior pituitary that secretes the FSH, we term it as a follicular stimulating hormones. These hormones won't work right now from here. No. These cells, okay, they develop by their own way, okay, by the help of this granulosa cell. You can say they are now surrounded by more granulosa cell. These granulosa cell now change their structure, okay, and they become the cuboidal, okay. So this is your primordial cell, okay, this is your primordial cell, understood? And the another structure as you are seeing, okay, another structure as you are seeing is your, yeah, is your primordial cell, is your primordial cell. Understanding? No problem. Primordial cell, okay. Now these primary primordial cell, okay, these primary primordial cells, they make this flattened cells, okay, they arrange themselves in a cuboidal manner, and now this cell, okay, this structure is called as the primary Graafian follicle, or you can say simply primary follicle, okay. This primary follicles, okay, now there will be an action of FSH. This FSH which is secreted, now they work on this Graafian follicle, sorry, the primary follicle, okay. And under the effect of FSH, this primary follicle, they change into the secondary follicle. They will change themselves into the secondary follicle. And there is an arrangement of this granulosa cell. Now it becomes the multi-layered. Understanding? This is your secondary Graafian follicle. Then there will be a tertiary Graafian follicle, okay, and then it attains one stage, okay, it attains one stage, and that is called as the Graafian follicle. Okay. Graafian follicles is different from the tertiary follicle, or you can say the secondary follicle, in the context of that the ovum which is present in this Graafian follicle cavity, they secrete one layer, okay, around themselves, and this layer is called as the zona pellucida, okay, it's called as the zona flaccida. And not only this, okay, not only this, these, you can say, these granulosa cells, they make the special kind of arrangement, okay, it make the special kind of arrangement into the two layers, and that is termed as the theca cell, okay. It surrounds itself into the two layers, and that is called as the theca cell, okay, that is termed as the theca cells. No problem understanding. Now these theca cells are two types, in the internal theca cell and external theca cell, okay. And there is the presence of fluid, okay, it's a fluid filled cavity, and this structure is called as the Graafian follicle, okay. This structure is called as the Graafian follicle. Are you understanding it? Yeah, this structure is called as the Graafian follicle. Now about, write down, it is a granulosa cell. Granulosa cell, okay. So once again, you just understand that during the intrauterine life, okay, female started there, you can say, the oogenesis, okay, and this oogenesis is happening in the two phase. This primary, you can say, the primary division, okay, the first meiotic division, it started during the intrauterine life, okay, it started during the intrauterine life, but it's continuously changing. It's not over right now, okay, it's continuously changing. It's not done yet, okay, it's not done yet, because there is a wide gap, okay. It started in the intrauterine life, then female birth take place, okay, but for birth to attaining the what, menarche, when the female will go menstrual cycle, it's like the wide gap, no, approx, you can say 12 year or 13 year, and in this year there is a suspended, you can say, this growth of the female gametes, okay, female gametes growth is suspended on an average or all about the 12 years, okay, 12 years, and during this time there will be a degeneration of many, you can say, the primordial cell. There will be degeneration of many primordial cells, and that is termed as the atresia. That is termed as the follicular atresia. 6 to 7 million, you can say, primordial cells are present when females are in her mother's womb, okay, but when she take the birth, only around, how much, I think it is present in the leg, okay, around the 60 to 80,000, you can say, the primordial cells are left, okay, and these primordial cells, they are further goes down, okay, they further goes down, and it only become, okay, write it down, in the intrauterine life, it's 6 to 7 million, okay, when she taken the birth, okay, when she taken the birth, on that time, when she taken the birth, on that very moment, there will be a presence of only, you can say, the 3 lakh, okay, to 6 lakh. Understanding? 3 lakh to 6 lakh, and it further undergo distortion or decrease in number when she started the menstrual cycle, first menstrual cycle. That's called the menarche. Understand? So the first meiotic system is running on the primary, the primordial cells. They undergo and become the primary follicle. Okay, these primary follicles, they change themselves into the secondary follicle, and the secondary follicle then change and become the Graafian follicle. Graafian follicle is characterized by the special arrangement of the, you can say, the cells, okay, a special arrangement of the cells, the granulosa cells, and there will be a one more protective layer is formed, that's called the zona pellucida. That's called as the zona pellucida. Till here you have any doubt? Yeah? No? Let's move ahead. Yeah? Let's move ahead. Now, these theca cells, they produce one strange hormones, okay, and that is called as the testosterone. Now you are thinking why I am saying it is a strange hormone. See, this hormone is a male sex hormone. Yeah, I know I am teaching the female reproductive system, but the theca cell which first produce is the androgen, and the principal androgen is your testosterone, okay? But this testosterone, okay, it is converted by the zona pellucida into the estrogen. Are you following? Yeah? The theca cell which produce the testosterone, which is actually a male sex hormone, but thank God there is the presence of zona pellucida layer which change this testosterone into the estrogen of female sex hormones. Now, this estrogen have so many functions, okay, but we will discuss only the two functions. First thing is that it work on the female uterus. Yeah, okay, it work on the female uterus, okay, and this estrogen, it tell to the uterus, okay, Graafian follicles is ready, there is any chances to have the pregnancy, okay, there is chances to conceive, so you should make some special arrangement, okay, you should make some special arrangement for upcoming guest. And here who is the guest? Yeah, it's a sperm. So under the effect of estrogen, okay, and you know about the layers of the uterus already, the outermost layer is called as the, yeah, it's a peritoneum, okay, middle thicker layer, okay, middle thicker layer is called as the, yeah, this middle thicker layer is called as the myometrium, very good, and inner granular layer, okay, it is called as the endometrium. Understood? So estrogens, they inform the endometrium to make some special arrangement for a special guest, and here the guest is whom? Yeah, it's your sperm. So for inviting, okay, for treating the sperm, this estrogen, sorry, the endometrium, they undergo special changes. The first changes is it start thickening, okay, it start thickening itself, its growth, okay, and this stage is called as the proliferative stage. So now come to the point what we are discussed, okay, during 1 to the around the 5 days, okay, 1 to 5 days, what is happening in the hypothalamus? There is a secretion of FSH, okay, FSH work on the primary follicle, okay, and make them to change into the secondary follicle. Understood? Secondary follicle. And here what is happening? The estrogen, this secondary follicle will change into the Graafian follicle, and the fundamental difference between the secondary follicle, or you can say the tertiary follicle, and the Graafian follicle is that there is a special arrangement of the granulosa cell, okay, there is a special arrangement of granulosa cell, and there is also a special arrangement of this, you can say, the connective tissue which is found around this secondary Graphian follicle. This connective tissue, they make the two layers, that we call it the theca layer, external theca and internal theca, and the granulosa cells is already present, okay, and this ovum, they secrete one protective layer, and this protective layer is called as the zona pellucida. Now what are the function of these layers? Theca cells start secreting the male sex hormone, which is like a strange, it secretes the testosterone, but the zona pellucida, which is a protective layer, ovum itself develop, it changes the testosterone into the estrogen. Now these estrogens, they go to the uterus and talk with the uterus, okay, hormones talk. Keep in your mind, hormones talk with each other. It talk with our organs, it talk with our gland, okay, and we can decode this talk by our own way, by our own understanding, but it may be changed in the future. Yeah, I already told you, no, you cannot put the full stop in the science. You have to always question mark and question mark. For a while, for today's acceptance is that these estrogens, they talk with this uterus, okay, they talk with the uterus, especially the uterus endometrium, and they tell this endometrium ki, okay, friend, you have to prepare, okay, maybe there will be a chances of the pregnancy, okay, so you should prepare yourself. Then endometrium, it's again, I not call it he, I call it she. She is the wise enough, okay, and she developed their structure, okay, she developed, proliferate their structure, okay, make them thicker, okay, make them thicker. Now, story not end at here. These estrogen, they also goes to the anterior pituitary, and they goes to the anterior pituitary and said, okay, I am estrogen, okay, I am estrogens. There is a formation of the Graafian follicle, there is a chances for the pregnancy. You don't send the FSH now, you don't send the FSH now. Now see how the selection is happening. Initially what happened, 10 to 15 every month, as I said, the 10 to 15 primordial cells, they participate in this event, okay, they both all become, you can say, the primary follicle, all become the primary follicle, okay, and under the effect of FSH all become the secondary follicle. But now what is happening here, once the estrogen is produced, okay, one Graafian follicle is produced, they send the message to the higher system, you don't secrete the FSH. Now those cells which is yet dependent upon the role of, you can say, the effect of FSH, okay, they will die. And the mature cell, that is your Graafian cells, which is fully developed, they won't need now the FSH, they can grow without the FSH. See how nature select the best follicle in this way, okay, they select the best, you can say, follicle in this way. Now what is happening, FSH will stop, and it become thicker and thicker, okay, it start developing. Now with the estrogen, there is also a secretion of bit progesterone, okay, bit progesterone, but estrogen concentration is high, and relatively the progesterone concentration is bit low, okay, it's a low. Now what is happening, these cells, okay, Graafian cells, on the 14th day, okay, on the 14th day, there is not any clear-cut idea yet what is happened in the hypothalamus. Suddenly the FSH level goes down, okay, FSH level goes down, and LH level attain the peak, okay, suddenly the FSH level goes down and LH level, see, the estrogen is sending the message to the higher system, okay, now you don't need to secrete the, you can say, these FSH and LH. FSH, you don't need to secrete the FSH and LH, okay, because already the one, you can say, the mature ovum, okay, or one Graafian follicle is already selected, she is ready, you don't need to worried about too much, okay, stop the secretion. But during the mid of the cycle something strange happen. These hormones which is giving the negative feedback to the higher system, okay, it loses their, you can say, the work, and suddenly during the 14th day there will be a surge of LH, that is called as the LH surge. And with this LH surge, this LH surge, these Graafian follicles will rupture, and there will be a release of one ovum, okay, surrounded by the zona pellucida layer, okay, surrounded by the zona pellucida layer, and there is the presence of some of the Graafian follicle. Now this zona pellucida layer which comes, okay, they are become wave like, okay, and now this zona pellucida is called as the this zona pellucida which have the crown like structures, it is called as the corona radiata. Are you understanding? Under the effect of LH, these Graafian follicles will rupture. How rupture? It's easy to understand. It have the more vascular supply, okay. LH start working on one, you can say, the particular area and make them avascular, okay. Due to this avascular formation there will be a formation of the stigma, okay, and this stigma, they undergo the ruptures, okay, and there will be a release of ovum along with their layers, okay, along with their layers. Understanding? No problem? Yeah, let's move ahead. Okay, now once it's released, okay, once it's released, this structure, okay, where now this ovum is disappeared, okay, it's gone away, okay, this structure, it's make one special, you can say, the arrangement. Now it is without, you can say, their member, without the egg, without the ovum, okay, this family lost their one, you can say, the child. But you know what, like when the family lost their child, okay, lost in the terms of they lose their child, okay, they are not in their control, but the family knows that, okay, their child is living, okay, they are alive. So the family don't have, you can say, the negative thought. Generally they don't have the negative thought about their child. They always praying good, okay, about their health, about their betterment. The same thing happening here also in the molecular level. The same, you can say, the orchestra, or the same, I don't call it drama, okay. So the same thing is happening here. Understanding? The Graafian follicles which loses their member, that's their precious member, the ovum, okay, but still they want to help. You remember that the theca cell secrete the estrogen. Theca cells secrete the estrogen. Now these estrogens is keep on secreting at least 10 to 12 years, okay, 10 to 12 years, because this is the nature of our, you can say, the cognitive process. We won't remembered things, okay, in our entire lifespan. We will forget, okay. So this family once also forget about their member. Once after the 10 to 12 days, okay, they also forget about their members. So now how they are helping their member? See, as you seen that the theca cell, okay, which is present in this structure, they intact with this structure, okay. The Graafian follicles bearing the theca cell which is producing the testosterone, okay, and this testosterone is replaced by the estrogen, okay, this converted by the estrogen by the zona pellucida layer. So here also the zona pellucida layer is intact, okay, and this theca cell is also present. Now these theca cells keep on producing the estrogen. It's keep on producing the estrogens of all of about the 10 to 12 days, okay, and this structure becomes the yellowish, okay, and this is termed as the corpus luteum. Write it down. This structure is called as the corpus luteum. Are you understanding it? Yeah. It loses their family member, okay, due to the rupturance, LH surge, it loses their family member, but it keep on supporting their family member, okay, its family member by producing the estrogen, Now, it won't help forever. It's help only about the 10 to 12 days. So, this estrogen, okay, its work again on the uterus, make them thicker and thicker, okay, make them thicker and thicker, understood? Now, this corpus luteum along with the estrogen, they secrete now in the massive amount of progesterone, which is previously less in number, okay. Now, after the, you can say the rupturance of their graphene structures, now this structure become the corpus luteum, a yellow body structure, okay. Now the progesterone, you can say the secretion is in massive amount, and relatively the estrogen amount become less. Understanding? No problem. Now what is happening? These progesterone, okay, it will again work on the uterus lining, the endometrium, okay, and now it says that, okay, why you are only proliferating, okay, make some now more arrangement, okay. So under the effect of the progesterone, the arteries which is present, okay, in this metrium, they become coiled, okay, more vascular, more warm environment, okay. It also affect the mucus quality of the cervix, okay, and make them thinner, okay, so that sperm you can swim. See how beautifully they are inviting the sperm, isn't it? Now this progesterone, okay, which is working and making them more thicker, okay, and develop more vascular, okay, more vascular. Now what is the fate of this ovum? These, you can say the corpus luteum, progesterone, they work on this female part of the fallopian tube, okay, and it stimulates it. Now this female, okay, they start, you can say, touching the ovary. They start touching the ovary where is the swelling. Once they found the swelling, during the sweepy movement, okay, it's take the ovum. And now ovum is in here, okay. Ovum is here, surrounded by the corona radiata, okay, Now, if sperm will come, understanding, if sperm will come, then it become the zygote, okay, then it become the further stages are happening, and then there will be a implantation. But suppose there is no any sperm right now, these corpus luteum, they continue secreting the progesterone to 10 to 12 days, okay, but once they won't get any masses, okay, it is thinking, okay, my member is alive, okay, I have to support it. It starts supporting 10 to 20 days, okay, but after the 10 to 12 days there is no progesterone, okay, then due to the less progesterone, okay, due to the decrease in the amount of the progesterone, okay, these progesterone treated blood vessels, okay, they become less vascular, or you can say the ischemic condition, ischemia. ischemic condition, okay, and it's shed off, okay, it's slough off, and there will be a bleeding, menstrual bleeding. Understanding? No problem? Yeah. If there will be no any fertilization, ovum will die, okay, ovum will die. It not comes along with, you can say, it is digested by the your immune cells like macrophages and neutrophils digest, okay, and due to the, you can say, no coming of the sperm, uterus weeping by the, you can say, the bloody tears, it weeping by the bloody tears, okay, it's slough off, and there will be a menstrual bleeding. On an average 35 ml of blood is coming in menstrual bleeding, okay, it's coming in the menstrual bleeding. Now suppose there is a sperm, okay, one sperm is coming here, okay, sperm is coming, okay, and during the Graafian follicle time, the meiosis 1 which we are talking here, okay, it's not yet completed. In the Graafian follicle time, the meiotic 1 division is completed, and the ovum which is present here, they started meiotic 2 division. Understood? Now from which time this meiotic 2 division will complete? It won't complete if there will be no sperm. It is a magical touch of the sperm which make them to complete their meiotic 2 division. Okay, as soon as the sperm, okay, touches the membrane, okay, the zona pellucida layer, understanding, the ovum completed their second meiotic division. Are you understanding? No problem. Now you know that there are many sperms, millions of sperm, okay, but you know ovum need only one sperm, no? If suppose if there will be a ovum is fertilized by the many, you can say, the sperm, then there will be a 10 to 12 baby. It's a very pathetic situation, no? It's very, you can say, the worthless situations. So the zona pellucida layer which is developed by the ovum, they play a very key role here. Okay, they play a very key role here. It is like a window. Initially all windows are open, okay, and as soon as one sperm first touches, the lucky sperm which touches this ovum, for by their touchness, okay, zona pellucida, you can say, block all the windows. Understanding? It's like on the female nature, no? Female initially it's like she is in one home, okay, one house, and once she is subject to marriage first of all, and if she got one desired husband, okay, then she shut off all. Now there is no any desire of again the marriage, okay. The same thing is playing by the her ovum also. Okay, the zona pellucida layer which is touches by the sperm, initially all the windows is opened, okay, all the zona pellucida windows is open. Once one sperm, the first sperm which touches this, then all these you can say the windows are shut off, okay. By this they prevent the polyspermy and ensure the monospermy. Write it down. By the activity of zona pellucida, okay, it ensures the monospermy, that one sperm should fertilize the ovum, okay, monospermy, and it should prevent the polyspermy. Are you getting my points? Yeah. Now the fertilization happened, okay, you know it, it undergo the cell division and proliferation, okay, and at the day of 7th day after the fertilization, if fertilization take place, then at the 7th day, okay, this structure which is fertilized, okay, changing their structure, they attached with the endometrium lining, okay. That has with the endometrium lining, but you know it that corpus luteum only will work in the 10 to 12 days, okay, and if it will lose itself, okay, then suddenly this membrane got shut off and there will be menstrual bleeding. You know it? I already told you. So during the 7 days, it touches this membrane, okay, and it sends one special message to the corpus luteum that, friend, your precious family member, your ovum is alive, okay, it is met with their destiny, their sperm, okay, and it is like it is sitting in a beautiful place, but it need your help. You don't degenerate at all. So corpus luteum will not degenerate till the first trimester, means 3 months. Their natural lifespan is 10 to 12 days, okay, but once they know the good news that their family member is alive, okay, and they want to grow further and they need their help, okay, it start working till the first trimester. And you know the one trimester means 3 months, and generally in one pregnancy, full term pregnancy, there will be a 3 trimester. So till the 1 trimester it will work, and after that there will be a formation of placenta, and placenta, once the placenta form, they will take the duty of corpus luteum and tell them, don't worry, I am here, you can now go, okay, you can now go, I will take care of it by secreting your same content, that is the progesterone. So placenta, we already discussed in the ovary lecture, that placenta also secretes the female sex hormone, especially the progesterone. And then there will be further story, there will be embryogenesis, development, and child will come. So that's what is your menstrual cycle, okay. Now let's conclude what we studied. We studied that the female menstrual cycle is a cyclic event, it's a natural event, okay, and it will only happen in 2 conditions. First of all, the organs, which is mature, organ is perfect structurally, anatomically, you can say the accurate, perfect, and second thing is there is a you can say the adequate hormones. That's the 2 conditions. Now the female menstrual cycle is not starting by the, you can say, only the ovary, okay, it is insult to it is insult if we talked about only the ovary. Their system is higher, okay, starting from the hypothalamus, okay, and further the higher system that is also, you can say, correlated with the limbic system, okay. We've seen all these things done. Now in the intrauterine life, when the fetus is in her mother womb, on that very moment they started in the 6th to 8th month of the pregnancy, they started this oogenesis process, they started the first meiotic division, okay, and but there will be a, you can say, the substantial suspensory period, okay, there is a substantial suspensory period about the birth from the menarche, about the 10 years or 12 years we can say, okay. Then in every month 10 to 12 primordial cells, okay, they participate in this beautiful event that's called the menstrual cycle, okay, and they all changes into the, you can say, the primary follicle, okay. Now these primary follicles under the effect of SSH change into the secondary follicle, understanding, no problem. Now the secondary follicle, they will change into the Graafian follicle, and once they change into the Graafian follicle, their first meiotic division, which is starting in the intrauterine life, that will complete, okay, and they start the second meiotic division, understood. Now the fate of this Graafian follicle is that there is a special arrangement of the cell, mainly the theca cell and the zona pellucida cells. Now the theca cell, they start secreting the testosterone, that's the male sex hormone, okay. Now this testosterone, it will be changed by the zona pellucida, converted by the zona pellucida into the estrogen, that's the female sex hormone. Now this estrogen, they send to the message to the uterus that, sister, you have to work now, your you can say your member is ready, maybe she will get the pregnancy, okay, maybe she will be a lucky, so you have to make some special arrangement. What arrangement? You have to grow thicker, you have to proliferate, okay, you have to proliferate. Then uterus, once heard this beautiful good news that, okay, one Graafian follicle is selected, it start proliferating, okay, and also they start developing the more vascular blood vessels. Now estrogen also goes to the higher system ki okay, please stop for a while, okay, please stop for a while. One Graafian follicles is released. Now the thing is that those follicles which is still dependent of the FSH, they will die due to the depletion of FSH, due to the less secretion of the FSH. And Graafian follicles, they don't need now the FSH, okay, they already developed. So by this method, the most of the, you can say, the follicles, secondary follicles, they are eliminated. Now the story not end yet here. These you can say the estrogen which goes to the higher system to less the FSH, okay. Now story is right now in the within the 14 days, okay, story is going on within the 14 days. On the 14 days, this hypothalamus, anterior pituitary, they won't listen. They become too much angry. Why you are coming and saying, you can say continuously that okay, you have to stop it, you have to stop it. It become angry and suddenly secrete the FSH and LHS. FSH is relatively low and LH becomes higher in amount in the blood. It's become the peak and we call it LH surge. We call it the LH surge. Now, due to this massive amount of secretion of LH from the anterior pituitary gland, there is a receptors of LH present in this membrane of the Graafian follicle. They goes, because they are angry already, they goes and they break the parts of Graafian follicle, okay. And this process is called the lysis process. Luteinizing, the hormone itself name is a luteinizing hormones. It luteinizes, it lyses the parts. There will be a avasculation, okay, there will be a formation of a stigma, and by this, okay, it's only happening in the 14th day, and in the somewhere after the 2 hours of the release of these LH hormones, there will be a rupturance, and due to this rupturance there will be a release of their Graafian follicle member, that's the ovum, okay, that's the ovum. Which ovum? Secondary ovum, remember, because the primary meiosis is done. Primary meiosis is already done in the Graafian follicle. It has started the secondary meiosis, means we have to call this ovum as a secondary oocyte. What? Secondary oocyte. Now come to the point. This secondary oocyte, they come with the zona pellucida layer with more protection, because now they are vulnerable, okay, they are now prone, because they are outside, you can say the out of their environment, their family. So it's become the spike-like projection, and that spike-like projection we call it corona radiata, a crown with the radiation, okay. Ovum comes with the crown, ovum comes with the crown. Now, okay, ovum comes, very good. Now the remaining structure which is left, okay, by the release of this, you can say the ovum, is called as the corpus luteum, okay. Although it loses their family member, but it still internally want to support her family member, okay. And for this, it keep on secreting the estrogen and progesterone. It keep on secreting the estrogen and progesterone, so all about the 10 to 12 days, about the 10 to 12 days. Now, once if a sperm will not come, okay, so naturally after the 10 to 12 days, these structures, they become die, okay, and it change into the white scar-like projection, and that is called as the corpus albicans, okay. Write it down. It is called as the corpus albicans, a scar-like white structure, okay. They won't leave any scar, there will be no any scar, understanding? It's called the corpus albicans. Now due to the depletion of progesterone, this membrane, endometrium membrane, they will start degenerate, and there will be a menstrual bleeding. Keep in your mind is that there are three, you can say, layer of endometrium. The two are the functional layer and one is the basal layer. Basal layer won't slough off, okay, it keep intact. Only the two functional layer which is developed under the effect of estrogen and progesterone, they will only slough off, okay, they will only slough off. So it loses their functional endometrium, okay, along with the contents, and there will be usually the 30 ml of the blood plus 30 ml of serous fluid, okay, and menstrual bleeding happen, okay. Now if The ovum is lucky enough, it get one sperm, okay, it get the sperm, then there will be a fertilization, okay, and after the fertilization, you know it, during the 7th day there will be a one process called implantation, by which the blastocyst, this structure is called the blastocyst. Blastocyst is attached. I am not going in detail of the embryogenesis, we will have further in future, we have the further lectures, but for a while you just understand that this blastocyst, okay, it have the finger-like projection called the cranion villi. These villi, they touches this endometrium and they make one connection, okay. By making their connections, it release one special message to the corpus luteum, okay, sister, don't degenerate. Your precious ovum is now fertilized, okay, it need your help, you have to stay, okay. And this message is, tell me what is this message? This is your HCG, human HCG, okay. This is called as the human chorionic hormone, okay. These hormones, if you in the early morning, you can say, if you want to miss the period, on this moment the female also miss the period, because now the endometrium is intact, endometrium is now intact, they won't have the bleeding, so she suspected, okay, maybe I got pregnant. So for that, in the early morning, she taken the one container of the urine, okay, and on that urine she investigate about this HCG hormone. If there will be a presence of HCG hormones, it ensures there is a pregnancy, okay. So during the pregnancy time, there is a, that's why during the pregnancy times female won't have the menstrual bleeding, okay, they won't have the menstrual bleeding. Are you understanding? Now the corpus luteum will work till first trimester, 3 months, and afterwards there will be a formation of one strong intimate connection, and that connection is called as the placenta. Placenta take over the work of the corpus luteum till the entire pregnancy, okay. They take care about their endometrium, they take care about their food, nutrition and all the stuff. Understanding? No problem? Yeah. So by with this we understand about the introduction, okay. Duration of the menstrual cycle, generally we thought that menstrual cycle is on an average 28 days, but female are allowed to have menstruate 20 to 40 days, 21 to 40 days. And we've seen there are changes, okay. Now you've seen the changes, no, it's like visual to you. The changes is in the uterus, how this changes, the changes is in their endometrium, okay. And as I said, they also make their mucus thin so that a sperm can travel, you know, they're inviting by their heart, they're inviting by their heart, they're making mucus also, the progesterone also treating the mucous membrane, understanding. And you've seen there is a dramatical change in the ovary. So during the menstrual cycle, just keep in your mind, there will be changes in the higher system, there is a changes in the ovary, okay. There is a changes in the uterus, there is a changes in the vagina, cervix, understanding? No problem. Now we are left with the applied physiology. I already initially told you there are terms called the amenorrhea, okay, oligomenorrhea, polymenorrhea, okay. These terms we will discuss in detail under the next lecture, that is called as the ovarian disorder. Ovarian disorders, okay. So by this we concluded today's class. So thank you with having me. Bye. Have a nice time.